Hi, we're at the Thyroid Cancer Survivors Association conference, and I'm here with Dr. Maya Lodish. Dr. Lodish, thank you for being here.
Thank you so much for the opportunity. It's an honor to be with you today.
Great. Can you tell us a little bit about yourself and your practice?
Sure. So I am a pediatric endocrinologist, and I practice at the National Institutes of Health within the Child Health and Human Development Institute. And I work together with our pediatric oncology colleagues on treating children with medullary thyroid cancer and understanding the course of the disease, the natural history.
Okay, thank you. So can you help us understand the difference between medullary thyroid cancer and other thyroid cancers?
Sure. So medullary thyroid cancer is much more rare than our standard papillary thyroid cancer, which is the most common type. It is a cancer of the C cells of the thyroid, which make a hormone called calcitonin, and they are called neuroendocrine cells, which are different from the rest of the cells of the thyroid gland. So they don't make thyroid hormone, they make calcitonin.
So it's a more rare form of thyroid cancer?
Yes, yes.
So how prevalent is this in children?
It is quite rare. We're talking 1 in a million kids.
Okay.
But what we do know is within the last 10, 20 years, there's been a huge growth in our understanding of the cause of this disease and about recommendations to follow these children and members of their family to help know the risks and to help kids have the best outcome possible.
And how does medullary thyroid cancer manifest in children? How do children come to you? How do they know that they have it?
Sure. So there's a couple of ways. So in certain situations, if there's a family where there's a history of medullary thyroid cancer, the parents know that they do or do not carry the mutation. So when I say the mutation, I'm talking about the RET gene, R-E-T. So there is a very well-known association between RET mutations and developing medullary thyroid cancer. So let's say a parent has a child and they get their child tested and they know that their baby has medullary thyroid cancer or the risk of developing it. What we often see, and now it's recommended, is that we actually see these kids after they've had their thyroid removed. It's recommended for certain high-risk mutations of RET that we actually do what's called a prophylactic thyroidectomy, which means taking the thyroid gland out in an otherwise healthy kiddo, and that might seem kind of strange, but it actually improves survival. You get the cancer before it starts, and that's kind of the best case scenario. And if you go to a center where they have high volume surgeons where they're familiar with this disorder, you have a really good outcome. Now, your question about the other kids that come to us, they also have hereditary thyroid cancer, but they may be the first person in their family to have it, okay? So in that case, they carry the risk of giving their children, they have a 50% risk of having their children develop medullary thyroid cancer, but they may be picked up, usually it's in the early teen years, and it's because they have either a lump in their neck or there are other manifestations that go along with medullary thyroid cancer in certain syndromes. So let me give you an example. In kids, we often see medullary thyroid cancer in the context of what's called multiple endocrine neoplasia, type 2A or 2B. And there are signs that to the well-trained physician, they know immediately. So with the MEN2B, you have these mucosal neuromas, which are like little lumpy, bumpy lesions on the lips and the tongue. And it could be the dentist who recognizes that and says, this is unusual. Or lesions on the eyes. You also can have a characteristic appearance where your arms and legs are rather long and you look kind of different from your siblings, and those can be kind of a key that there may be something else going on. But I am constantly fascinated by the different ways kids come to us, and sometimes it's the mass in the neck is actually obstructing breathing, and it's thought to be, an asthma attack, and the child goes to the ER, gets a dose of albuterol, gets worse. So you always need to do a chest x-ray if you have a first-time wheezer. There are, kids who come with Pheochromocytoma as the first symptom, and that's another kind of neuroendocrine tumor that goes hand in hand with medullary thyroid cancer and these inherited syndromes. So that may be the first interaction they have with the physician.
And how is that found?
So a pheochromocytoma presents with the classic symptoms of having a racing heart, having high blood pressure, feeling very sweaty. And now that we know that kids with certain types of medullary thyroid cancer have up to a 50% risk of developing these other tumors, these pheochromocytomas, there are recommendations to screen for them with blood tests called metanephrine. So we can screen for them, and we can, take care of them before they develop into a problem.
Okay. If I'm a parent of a child with medullary thyroid cancer, what should we expect in terms of treatment?
So the treatment depends on the extent of the disease at the time of diagnosis. So if it's isolated to the thyroid gland, surgery is the first line of therapy. And I can't emphasize enough the importance of going to a surgeon who's really experienced in pediatric surgery and in medullary thyroid cancer surgery, because the extent of the dissection of the tumor is really important. Beyond that initial surgery, it's a lot of watchful waiting. We have some therapies that we keep in our pockets for when the child needs them later, but you're balancing the therapy with the side effects of the therapy. So we don't rush to give therapy to everyone. So it's a disease that you're living with for the rest of your life. It can be what we call indolent or very slow growing, so people can live for many, many years with medullary thyroid cancer, but it carries with it the anxiety, and you need to keep getting screened. So by that I mean calcitonin levels, which are a marker of disease burden, metanephrine levels, which are a marker of the pheochromocytoma developing, and imaging studies if the calcitonin is rising to see if there are lesions. And unfortunately, standard chemotherapy and radiation do not work very well with this type of cancer. So we have some targeted therapies, the tyrosine kinase inhibitor class of medications that are pills that you take once a day. And those we have used in children at the NIH in collaboration with the Cancer Institute. I've been privileged to be part of a trial of one of these medications, vandetanib, in children with metastatic medullary thyroid cancer. And that's one of the areas I'm speaking about today.
Thank you. So because it's so rare and highly specialized, sounds like, or very personalized treatment, how important is it that, again, if I'm a parent with a child who has medullary thyroid cancer, that I find someone who specializes in this type of cancer, or do I need to go to a cancer center of excellence?
I would highly recommend that not only for the child to get the best care possible, that you do seek out a center with experience in treating medullary thyroid cancer, but also for the added benefit that you become part of a community of other families that are going through the same kind of process. And I can't emphasize enough how important it is for kids especially. It's hard enough going through adolescence and feeling different, but when you have this added on, it's an extra challenge. So for the kids to reach out to each other is really beneficial. So I should say at the NIH, we actually have a natural history study for children with medullary thyroid cancer, and it also helps us as physicians to learn more about this rare disease by having the privilege of seeing lots of children, together with this disorder, so that we can look for other clues to issues that might be going on related to the syndrome, how we can, monitor kids for side effects of treatment. And we can't really judge how well our therapies are working unless we understand the natural history of the disease better.
Okay. Is there anything else you think that parents of children with medullary thyroid cancer should know or do?
Well, I think meeting with a genetic counselor is incredibly important because we now know that if you develop medullary thyroid cancer in childhood, it's really 100% related to a mutation in the gene RET, R-E-T. So having knowledge, in my mind, is power, and it empowers the patient to know what they're at risk for so that they can deal with those risks. And so knowing whether the parents are carriers, whether siblings are carriers, even reaching out to extended family, the genetic counselor can help with that. Can also help with, if patients want to have their own families later on, you can do pre-implantation genetic diagnosis. So that's a really important aspect to educate families about so that they have that knowledge. Also making sure that you're aware of the screening guidelines for the other associated problems for the pheochromocytoma, for hyperparathyroidism in the case of MEN2A, and making sure that you don't get frightened and anxious and let it interfere with your daily life, because it should be something that you're struggling to overcome, but not that defines you.
Right, and that's where the support in the community comes in place, right?
Yes.
Thank you so much, Dr. Lodish.
Thank you for the opportunity to speak with you. It's been a pleasure.